is Diane Yantel. Thanks for joining the National Low Income Housing Coalition's weekly call on coronavirus, housing, and homelessness. As always, we have a pretty large call, so I see many of you joining rapidly now. I'm going to wait another 1 to 2 minutes so we give time for others to join, and then we'll get started on the call. Thanks. Hi, everybody. Thanks for joining the call today on coronavirus, housing, and homelessness. I'm going to give it another 1 minute or so before we get started to give time for others to join. Thanks for your patience. Okay, hi everybody. This is Diane Yantel with the National Low Income Housing Coalition. We'll go ahead and get started with our weekly call on coronavirus and housing and homelessness. Thank you all for joining. As always, we have a pretty large call, and folks participating in today's call range from people who are themselves experiencing homelessness, low-income renters, resident leaders, service providers, housing providers, shelter providers. We have federal, state, and local policymakers on the line, foundations, and some members of the media that have joined today. So I appreciate you all taking the time to hear about what's the latest happening on housing, homelessness, and coronavirus at the federal, state, and local levels. So I did want to start off by sharing some big, exciting news, which hopefully you all saw when we announced this morning. And that is that Chairwoman Maxine Waters, Representative Denny Heck, and Senator Sherrod Brown are introducing companion bills for the Emergency Rental Assistance and Rental Market Stabilization Act. And this is the legislation that we all collectively have been pushing for some time to provide $100 billion in emergency rental assistance to provide housing stability for low-income renters during and after the pandemic. So we're really excited that these bills will be introduced. They will be formally introduced on Wednesday. What we're doing now is working to get as many original co-sponsors as we can on the bill before introduction. And then of course, we'll continue to work to get increased support after introduction. As of this morning, when we sent out our announcement, there were 70 original co-sponsors in the House. We've already achieved another at least 15, maybe 20 co-sponsors just in the last couple of hours. So your calls and your emails and your contacts with the Hill are working. Please keep it up. We'd love to get to 100 original co-sponsors before introduction in the House. And we're also working on original co-sponsors in the Senate. So be sure to call your senators too and urge them to support Sherrod Brown's bills. Obviously, these bills are, you all know why they're so important. It's especially meaningful to have the chairwoman of the House Financial Services Committee say that this bill is her top priority in the next spending package, and she has said that many times. She's also conveyed that message to Speaker Pelosi, and also to have Senator Sherrod Brown, who of course is the most senior Democrat on the Senate Banking, Housing, and Urban Affairs Committee. So really important champions of these bills. You can find on our website and in the email alert that we sent out today a fact sheet on the HEC bill, and I see that Sarah has also posted a link to that in the chat box. You can also find a list of all the current House co-sponsors on our website, and we're updating that as new co-sponsors come in. This way, we have their Twitter handles there too, so you can thank them if they're already co-sponsors, or you can reach them and urge them to get on if they're not. And we're using the hashtag #RentReliefNow, and I encourage you all to use that as well. We've also had some great tweets from Senator Brown and at least 10 members of Congress who are tweeting about their support for this legislation. So the more we can amplify that and their tweets and do our own with that same hashtag, the better. Sarah will talk about this more at the end of the call, but I will say that it's a critical time. We know that Speaker of the House, Nancy Pelosi, is now getting from the chairs of all the House committees their top priorities to be included in the next CARES package. And as I said, Chair Maxine Waters has the $100 billion as her top priority. We want to shore her up as much as we can with really strong co-sponsorship, and also really keep the pressure on Speaker Pelosi to be sure that this is included in her starting point for negotiations in the next CARES bill. So again, we'll talk about that a little bit more at the end of the call, but just wanted to share that really exciting good news and encourage you all to keep up your calls and your contacts because they are working. Also wanted to share, we've talked many times in previous calls about the need for a searchable database from Fannie Mae and Freddie Mac to know which of their properties are covered under the federal eviction moratoriums. So last week we heard from Mark Calabria, the director of the Federal Housing Finance Agency. He shared with us that both Fannie Mae and Freddie Mac were working on their own lookup tools, and today they announced that both lookup tools are now public. So we'll share the links for those as well. They decided to do separate lookup tools rather than a combined one. So Fannie Mae has its own and Freddie Mac has its own. But that is a place where renters can type in their address and learn whether or not the property that they live in is covered under a federal eviction moratorium. So I encourage you all to look at that. You'll also remember that the National Low Income Housing Coalition has our own searchable database with the same essentially data from Fannie Mae and Freddie Mac, as well as data from Treasury, USDA, Veterans Affairs, and HUD, all in one searchable database. So it's as comprehensive as it can be at the moment, although it's not complete. But I would encourage everybody to please continue sharing our database widely. We continue to hear about illegal evictions that are prevented when renters or their legal aid attorneys discover through our database that their property is protected under the federal eviction moratoriums. And I will say that it continues to be the case that our database and Fannie Mae and Freddie Mac's new lookup tools that we announced today all lack data on the properties that are 1 to 5 units. So they have still not made those data public. So there is still a significant gap in public knowledge over what properties, small properties, the 1 to 5 unit properties, which of those are covered by the moratorium. So we continue to push and urge FHFA, Fannie and Freddie to make those data public. We sent a letter from the National Income Housing Coalition to Mark Calabria urging him to quickly make those data public. So certainly we'll let everybody know when they are made public. We also are continuing to update materials on our website. So we have a number of FAQs on everything from the economic impact payments, unemployment insurance, renters' rights, FEMA resources, and more. And we're working to get those all translated into Spanish. You can find those on our COVID-19 page on our website. And a reminder that in addition to these national calls where we share a lot of information, we have a number of smaller working group calls throughout the week that are more of an opportunity for discussion and sharing of information and conversation. So our next Tenant Talk Live call, which is a call for low-income renters and resident leaders will be on Monday, May 11th at 6 p.m. We have our regular weekly legislative working group calls. The next one is tomorrow at 12:30. That'll be an especially important one now that the bills are being announced, to talk about how we really push to get these across the finish line. Tomorrow afternoon and every Tuesday at 3 o'clock, we have our Working with FEMA working group. And on Wednesdays at 3, we have our state and local implementation working group calls. So I encourage everybody to join whichever of those calls are most relevant to your work. We have really good conversation on those calls, and it's an opportunity for all of us to learn from each other about what's working and what's not, and figure out how we can work together to overcome obstacles and get additional resources. And then finally, I would just say to keep sending your questions. We'll do our best, as always, to get those questions answered throughout the call from our speakers or our staff. And we will also continue to use those questions to create new FAQs to try to get the answers out widely. So you will have seen on your agenda that the first speaker is Congressman David Price. He is speaking on this call, but he won't be speaking first. He'll be joining us later in the call. So first, I'm going to turn to Nan Roman from the National Alliance to End Homelessness. And I'm really excited for Nan to join because we have talked on this call and in both the FEMA working group calls and in the state and local implementations calls really at length about the need for a framework for how local providers and local decision makers can use all of the new resources in a strategic way to meet the most urgent needs. So Nan and her team at the Alliance have put together a really terrific document that is exactly that. It's a framework for COVID-19 homelessness response. And so Nan's gonna talk a little bit about what's included in the document and how you all can use it. And Sarah is going to post a link to that document so you can access it while Nan's talking or after. So Nan, I'll turn it over to you.
Okay, great. Can you hear me all right?
I can hear you just fine.
Great. Okay, thanks so much, Diane. Thanks for your partnership and for everything that you're doing. So, as you know, via the CARES Act, jurisdictions are going to receive $4 billion in emergency solutions grant funding, as well as other money that they can use to help homeless people. And as Diane just mentioned, we're hoping there are going to be additional funds in the next stimulus bill, in addition to what she discussed also, hopefully for homeless people specifically. It's really critical, though, that these funds are used strategically and quickly to address both the public health and the economic recovery issues of people who are experiencing homelessness. Homelessness really could grow or shrink depending on how this money gets used. We all know, too, that of the racial and equity disparities that have arisen during the pandemic, and these are reinforced by similar disparities in homelessness. So it's also critical that these disparities are addressed with this money. Some of your jurisdictions are already on top of all of this and have been doing good planning and are set to take outcome-oriented steps toward it, but many others really are not. And even though it was very nice of you, Diane, to give the Alliance all the credit for coming up with this framework, and Aliva at the Center on Budget and Policy Priorities, and Matthew Doherty as a consultant to the Alliance, along with the Alliance staff, have put together this framework for the COVID-19 homelessness response. And the purpose of it is to help jurisdictions use the money widely. It's targeted really to the recipients of ESG funding. But if you're an individual program or an advocacy organization, hopefully you can use it also to encourage the recipients of ESG funding in your jurisdiction to follow this framework or use its guidance. The framework indicates the order in which things should be done. So it has immediate strategies that should be underway now, and then short, medium, and long-term strategies, all of which should be underway within the next 60 days. The guidance covers 4 areas: unsheltered homelessness, shelters, housing, prevention and diversion, and systems change. I can't go into the details, obviously, because not time. You can look at it, but in each of these areas, there's specific strategies. And the framework indicates what federal funding sources could be used to fund those strategies as well. Not yet on the site, but coming will be all of the tools, protocols, handbooks, etc., that various groups and jurisdictions have developed to implement those strategies. And if you all have any of those you want to share with us, we'll be glad to consider putting them, attaching them to the framework. That should be happening within the next couple of weeks. There are a few very important overarching values that we feel are integral to the framework. One is that all components of the framework have been developed using a racial justice and equity lens, so that those issues are taken on from the beginning of the work. Second is that the framework guides communities to address the most urgent needs first. Only after everyone who is currently homeless is helped, for example, should we really be looking at prevention for higher need people. And finally, real operational partnerships will be needed to meet both the emergency and long-term needs that this addresses. The actions in the framework are going to have to be funded and coordinated across many partners. The homeless system is not able to do the whole job. Many partners and systems in all levels of government, emergency management, cash assistance programs, public, physical, and behavioral health care, homelessness, of course, and housing, food and nutrition, corrections, child welfare, TANF. Everybody will have to be involved to some extent. Moving forward, the Alliance and the Center are going to be collaborating with the National Low Income Housing Coalition, the National Healthcare for the Homeless Council, and Urban Institute on this. And we'll have help from consultants including Matthew Doherty, Barbara Poppy, and Mark Dones. We'll be adding key strategies to the framework. It's not complete by any means. It's going to be updated every 2 weeks. The framework's now situated on the Alliance's website, which is endhomelessness.org, as I think you'll see. It may also be available on other websites, depending if we can figure out how to make that work. We may have a chance here, if we use our resources widely, to address the public health and economic recovery needs of people who are currently homeless, to improve racial and economic equity, and to change the way the homelessness system works for the better. But we're going to have to be strategic, and we're going to have to act with urgency, and hopefully this framework will help with that. Thank you, Diane.
Great, thanks so much, Nan. I really encourage everybody to take a look at this as soon as possible. It's very important, and it's really well done. And I look forward to the continued collaboration and partnership on this. And yes, Nan, thank you for mentioning, of course, Anna Levo's role in this, and to share with everybody that on our smaller working group call on Wednesday on state and local implementation, Anna Levo is going to join that call, and we're going to spend a good amount of time with her going into more details and plenty of time for questions and conversation about this document, about how it can be used and how it can continue to be improved. So thanks again very much, Nan. Appreciate you. So now we are going to turn to our next topic. Sorry about that. So now we're going to turn to our next topic, which is working with FEMA to get resources to pay for non-congregate shelter. And again, this has been an ongoing topic that we've discussed at length on this call. We've heard from FEMA and from different states about how these resources are being put to use and any challenges that are being faced. So there's two things we'll talk about now in this topic. First, we're going to hear from Joseph Galetta, who's the Director of Emergency Management at the New Jersey Department of Human Services, about how they have worked with FEMA to achieve funding to pay for non-congregate shelter. And then myself and Sarah Sadian from the Coalition are going to talk about a new guidance that we've put together for how other states can take similar actions to get FEMA's dollars and put them to good use. So first we'll hear from Joseph Galetta, again, Director of Emergency Management in New Jersey. And Joseph, I'll turn it over to you. Thank you.
Good afternoon. Can everyone hear me?
Yes, thank you.
Oh, thank you so much, Diane, and thank you for the coalition for inviting me to speak briefly on non-congregate sheltering, especially as it relates to the state of New Jersey. Just a brief introduction. The state of New Jersey has emergency management coordinated by the New Jersey State Police, and Colonel Pat Callahan serves as the Director of Emergency Management, and as such, he's responsible for putting together the state's emergency operation plan. There's 15 different sections to the plan, and Commissioner Carol Johnson serves as the Commissioner for the Department of Human Services. She's responsible for the 6th portion of that plan, which deals with mass care and emergency assistance. So that's sheltering, feeding, distribution of emergency supplies, and family reunification in the aftermath of a disaster. So as you all know, with mass care, we're engaged with the coronavirus response in the state of New Jersey. We're working very closely with the Department of Health in this state in trying to address all the different issues that are coming up with this pandemic response, because it's not a normal hurricane or flood type of disaster. This is seeming like a never-ending type of response activity for all those engaged in emergency response. So we're working in coordination with the state police and our other state agency leads in responding to this coronavirus pandemic. And we all know that disasters start local and end local. So we work closely with the local townships. If they have issues, they ask for assistance through the county offices of emergency management. And if the counties need assistance, they go to the state. So if we need assistance, we ask our colleagues from FEMA Region 2 to help us out. And that's what really has been going on here in the state of New Jersey. We now have FEMA here because we had a disaster declaration declared that takes us back to January 20th for coronavirus response. And as such, it opens up different types of funding from FEMA. Most importantly, we have FEMA public assistance funding, which deals with Category B under public assistance, which is emergency protective measures. And also under individual assistance, we received crisis counseling funding from FEMA. As you know, behavioral health is very important in this time of crisis, not only for the people we serve, but for the first responders as well that are working this 24/7 operation for this pandemic, and it's really draining on a lot of us. So it's good that we have this crisis counseling individual assistance grant approved from FEMA. We're working in coordination with the state to try to get additional individual assistance program funds, whether it's for disaster unemployment, housing assistance, or some type of disaster legal assistance. So we're working with our state partners along with FEMA to try to get that approval for full individual assistance. But non-congregate sheltering has always been an issue. As you know, with any disaster, normally when we shelter people, it's in a congregate setting. But with a respiratory-borne illness, that's not really conducive to an operation like this. So we looked into non-congregate sheltering. And working in coordination with the Commissioner of Health, Judith Persicilli, we received a approval letter from her that, working with the state police, we submitted to FEMA Region 2 for us in the state to engage in non-congregate sheltering. And on April 9th, we received a letter from FEMA Region 2 approving our state to participate in non-congregate sheltering, meaning not go into a normal shelter setting like a gymnasium, but try to use hotels. And we have partnered with a number of different hotels in this state to serve as a non-congregate sheltering setting. The approval letter we got from FEMA allowed us to shelter 5 different types of individuals under non-congregate sheltering. The first was for homeless individuals that may live in congregate shelters who are symptomatic or tested positive for COVID-19. The second is for homeless individuals who require quarantine or isolation due to being symptomatic or having a positive test for COVID-19. The third is for children and adults living in congregate living settings who have tested positive for COVID-19. The fourth is for first responders and healthcare workers who do not require hospitalization, but nevertheless need to avoid direct contact with their families due to exposure to COVID-19. And the fifth one is for other groups that may need assistance as the state continues to respond to COVID-19 pandemic. That's almost like an open type of bucket that we're falling into where we can expand our non-congregate mission. Our mission that was approved by FEMA is good until May 10th. So usually they grant 30 days extensions. The state right now is in the process of requesting a 30-day extension to this, which would take us into June. So we're providing data to FEMA about how many types of shelters are opened up and how many are going to keep going for that longer period of time that we need the extension from FEMA. So we're working on that process with the state. We believe this non-congregate sheltering approval is a blessing for us because we were running into a lot of situations where our homeless shelters were very crowded and we needed to find a place to take care of our homeless population in an alternate type of setting that would be conducive to a respiratory-borne illness, which of course would be a hotel setting. So the fact that we have approval from FEMA for emergency protective measures, all the costs associated with a non-congregate sheltering mission, the acquisition of the facility, the staffing to support that mission, feeding, janitorial services, linen, all those wraparound services that support the non-congregate mission would be approved under FEMA with the non-congregate sheltering approval letter we received. Right now, the state of New Jersey gets a 75-25% split from FEMA. I know our state police colleagues are trying to promote through FEMA to get 100%. With Hurricane Sandy, we got 90%, 10% cost share. So I know the state is seeking 100% reimbursement for all activities associated with COVID-19, and I'm sure other states throughout the nation are looking to do that as well. But like I said, we're working very closely with the state police in non-congregate sheltering missions, but it's very beneficial that FEMA given us this approval and the fact that now if we engage in this, we'll get reimbursed in the back end with this disaster declaration for New Jersey, which is DR 4488. That's our disaster declaration designation for New Jersey. So I hope that was helpful to some of you that may be engaged in this. I would encourage you to work very closely with your offices of emergency management since they are the experts in reimbursement from FEMA and know how much documentation is needed for the reimbursement process. But it's just very important you engage with your partners in the Office of Emergency Management if you're going to engage in non-congregate sheltering missions. Thank you, and I'll answer any questions if there are any.
Thanks very much, Joseph. That was very helpful. Really appreciate you taking the time to share those helpful tips that other states can replicate. A question from myself and also others who have typed in is you had mentioned early on that you were seeking individual assistance from FEMA. So can you say a little bit more about the types of individual assistance that you're requesting and what that process has looked like?
Well, the state of New Jersey is looking for a full individual assistance program approval. Like I said earlier, we only got crisis counseling. I think most of the states at this point have gotten that. So what we're using, and I don't know how other states are doing this, our divisions from the Department of Human Services collect data from the county welfare agencies, the boards of social services, and also we have our 211 call center that's collecting information. And since the pandemic, we've seen a tremendous spike in applications for social services that we're going to utilize to submit to FEMA. As most of you probably know, New York, New Jersey is a hot zone when you talk about coronavirus response. Our state alone has over 6,000 deaths related to coronavirus. So it's very important that if we apply for the full program to open up all the assistance that would be available, whether it's funeral expenses, disaster unemployment, disaster legal assistance, other types of assistance under individual assistance, that's what we're looking to do, working in coordination with the state and a bunch of data we're trying to submit to justify a full individual assistance grant program. Not saying we're going to get it, but I think the numbers speak for themselves. And our 211 center here is giving us a lot of good data that shows a significant spike since the pandemic progressed, and especially our county welfare agencies showing a tremendous spike in just the month of April that we can justify to FEMA that we need the full individual assistance program turned on. So we'll see how that goes. They might, like you said, they might only offer us certain programs. That's fine, but we want to at least submit for the full program at this point.
Yeah, absolutely. I'm so glad that you are, and would love to stay in touch on that in terms of the types of data that you're submitting and any kind of response that you're getting from FEMA, because we are certainly encouraging other states to also be requesting individual assistance. I think the more states that do, the more possible FEMA might be willing to reconsider turning on some individual assistance programs for states. There's also a question about whether the request for individual assistance will cover people who were homeless prior to the coronavirus, or whether you are focusing on people who are displaced due to the coronavirus.
Individual assistance would apply to anyone that submits, just like with a hurricane. Anybody that submits for individual assistance, the FEMA number would be set up and you would call into that number to get on the individual assistance grant program. And then the FEMA case managers would reach out to you to see what types of programs you'd be eligible for based on the impact of the particular disaster, in this case, the pandemic.
Right. Great. Okay, well, thank you again, Joseph. I really appreciate you taking the time, and thanks for your good work, and would love to stay in touch on progress that you make and have
Yes,
you back in the
please.
future call.
And I'll definitely share with you any type of data that would be helpful to other states in the nation pursuing this.
Great. Thanks very much.
Thank you.
So as I mentioned, there's one more issue related to working with FEMA that I wanted to discuss briefly, myself and Sarah Sadian, who I'll invite to join on. But, and I'll answer a few more of the questions that have come in related to FEMA too. You all know, and we've shared previously, the document that we created as the National Low Income Housing Coalition on working with FEMA, and some guidance about what are public assistance dollars, what is category B, who's eligible, how do you apply, and so on. And those, I think, still may be useful for some of you. We've just now, Sarah and Noah Patton from the National Income Housing Coalition have created a new document that we're calling Getting to Yes, Working with FEMA to Fund Non-Congregate Shelter. And in this new document, which Sarah, I think she shared the link in the chat box, and in the follow-up documents that we send out, or the follow-up email that we send out, we'll of course share a link again. But this is where we've pulled together all of the information that we know about the 8 states that have agreements with FEMA to fund non-congregate shelter. And we've shared the documents that the public health officials have submitted, that the states have requested from FEMA, and the responses that they've received from FEMA. And we've kind of ranked them in terms of which states have the most comprehensive agreement from FEMA and which have the most restrictive. And so there are 8 states right now that have these agreements with FEMA. Those states are Connecticut, New York, Ohio, North Carolina, California, Minnesota, New Jersey, and Virginia. And they really do range in terms of what FEMA is willing to pay for in each of those states. Interestingly, New Jersey actually has one of the more restrictive agreements compared to, say, Connecticut, that has a very broad agreement in terms of what FEMA is willing to pay for. And we offer this information and this analysis so that both the states that have restrictive agreements can go back to FEMA and push for more money to cover the needs, and also for all of the states who have not yet gotten to any kind of agreement with FEMA to keep pushing for it. And I think in some cases, states have tried and had some challenges, like in the state of Vermont, and are trying again. Other states, I think, are just not seeing these resources as ones that they can access. And in my view, that's really a mistake, because this is just money on the table that should be used by all states to pay for non-congregate shelter. We know that just as of last week, FEMA has said that they have so far spent only $6 billion in total in response to the pandemic. And that's out of about $70 billion that they have available through the Disaster Relief Fund. So really, I hope that all states will look at this document and figure out what they need to do to go back to FEMA or in some cases in the first place to reach out to FEMA to get those funds for non-congregate shelters. And also in the document, we give some recommendations for how to do that based on what we've learned from the states who have been successful. And we also share something that Joseph mentioned that we all need to start concerning ourselves with, which is the deadlines for reimbursing these hotel rooms. And so in the back of the document, we have a table with all of the states that have agreements and when their deadlines for reimbursement, when their FEMA approvals expire. And in Connecticut, they had their first expiration date on May 1st. I believe that has been extended. Other expiration dates are just around the corner. I do expect some of those earlier dates to be renewed pretty easily, but I think the further out we get and the more states start reopening, the more difficult it's going to be to get those dates extended and to get FEMA to continue to be paying for those hotels. So we really need to track carefully those dates and be pushing FEMA to extend them in all cases. So Sarah, is there anything else you wanted to say about the document or about the guidance?
Yeah, I just thought it might be helpful to pull out some of the recommendations that we have based on analyzing the different state agreements with FEMA, some of our lessons learned, which you can read about more in the document I shared in the chat box. So I think the number one thing that advocates need to know about when they're pursuing these funds is to ensure that they're working closely with their state public health official to make sure that those public health officials are defining this public health emergency as broadly as possible. In states where the public health directive was very narrow, it led to a very narrow outcome for FEMA resources. And so that's a place where advocates can be playing a really big role. If you look at Connecticut, for example, they defined the public health need as decongesting all shelters and serving all people who are experiencing homelessness, and didn't limit that public health directive to just, for example, people who are homeless who've tested positive or who are exhibiting symptoms. Another very important recommendation is to then take that public health directive, hopefully as broad as you can make it, and have your governors request resources at the same scale, and if possible to include that public health directive as evidence of why they need this assistance. It's very important that we're framing this around the public health need and not any other needs that are associated with serving people who are homeless. We found that in states where it was not a public health official that made that directive, maybe a different federal state agency, we saw that applications for this assistance were rejected. And so that's something to keep in mind as well. There are a couple of other recommendations in the document, and I encourage you guys to take a look at it. We'll continue to build this out as we get more information about more states that have reached agreements or issues as such assistance is reaching their deadlines, but it's a really good tool for you guys to get started with. Thanks, Diane.
Yeah, thanks, Sarah, and thanks to you and Noah for your work in putting this toolkit together. Again, to say to everybody on the call, it includes everything that we know, but there's certainly a lot that we don't know. So if there's states that you're working in where you have information about challenges or success with FEMA and it's not reflected in the document, please just reach out to us and let us know, and we will add it on and continue to expand the document. And then also to say that on this week's Working with FEMA working group call, which is on Wednesday at 3, we'll go into this in more depth and leave plenty of time for discussion and conversation. So please join if this is of interest to you and take a look at the document in advance so that we can really dig into it during that call. Okay, so we're going to turn to our next topic, which is an ongoing topic on these calls around racial equity and coronavirus. And our speaker today on this topic is Chandra Crawford from the National Alliance to End Homelessness. So Chandra, I'll turn it over to you.
Okay, thank you, Diane. So the COVID-19 pandemic is not affecting all communities the same way. So I'm sure most of you probably know that. So we cannot talk about this crisis without addressing race. And so as more and more states begin to report demographics, we know that Black people are disproportionately impacted. So let's do a little background. So we know in general that Black people are less likely to live in neighborhoods where healthy foods are readily available. You know, you hear things like diabetes and heart disease, but if you think about the structural stuff, and you think about poverty, homelessness, you know, you make those connections. That gives you some answers to why we see these disparities. To continue on, so Black people are more likely to live in substandard housing, have less access to health care, or you know, more likely to lack health insurance. And this is just to name a few. So in sum, for those who might not really understand the connection, COVID-19 poses a higher risk to Black people because of these underlying health, social, and economic disparities rooted in historical and structural racism. And so, you know, and I'm sure a lot of you have heard about the demographics recently, about the disparities. And so while we might not necessarily know the housing status of all of the people in the reports, we are certainly aware, those of us in this field, of the disparities that exist in the homelessness system. And so we know, well, a lot of us know. So for those who don't, let's just say that Black people represent 13% of the population, and yet 40% of the people experiencing homelessness. And if we look at poverty, Black people probably represent about 25%. So they're still overrepresented if you talk about the 13 and the 25. But we know that poverty alone doesn't account for homelessness, because that percentages of Black people experiencing homelessness are even higher than that. So when you put the medical vulnerabilities that disproportionately affect Black people together with their overrepresentation in the homelessness system, you can see how the pandemic could particularly be catastrophic for this group. So you get an idea of some of the structural stuff, and I'm sure many of you know this already. But here's the biggest thing that I want us to take away from this discussion today, and that is, what can the homelessness system itself do to make sure it isn't perpetuating disparities, right? So we know all this structural stuff, and I just mentioned lack of grocery stores, but that doesn't mean that the homelessness system is exempt, and it doesn't have to look at itself, right? And so at the Alliance, and this will be out, I'll give some dates at the end, but so we've added a COVID-19 tab to our racial equity data tool. And this was created by Racial Equity Network. So the data tool, it's a really simple spreadsheet that helps communities determine whether outcomes vary by race or ethnicity. So the tool looks at basic points, right? So this is just in general. Who's in your system, who gets what, and who returns to homelessness. And so it's most certainly urgent that we do the same with COVID-19. It's urgent that we gather demographic data about who's contracting the virus, who's getting tested, who's getting housed. So without racial data, we cannot see if there are disparities, the same that we've been putting out normally, although we all know that homelessness is a crisis, and so it just didn't begin with the pandemic. But if you don't see disparities, if you're not analyzing your data, then you probably don't factor them much in your approaches and in your response. So it's really important to do. So that's what I really want to emphasize today. So if you haven't started to look at your data, you can most certainly use our tool. It's part of our racial equity tool. We added the tab to start, and it's the same simple tool just to kind of help you organize and lay out what's happening in your system. And so I believe that's coming out today. It's up and ready. I don't have a link yet because I don't think it's out yet, but it will be by tomorrow. I just gave the final check off. And so go to our site, naeh.org. A lot of communities, a lot of COCs are already used our racial data tool. It's very simple, so you're familiar with it. It's just a simple tab to help get people started if you need it. So thank you.
Thank you, Chandra. Really important guidance and information. I appreciate you sharing it. And when those links are available, we'll be glad to send them out in the recap email that we send out to this full list. So send that, yeah, thanks very much. So I'll turn now to the next topic, which is state and local rental assistance. Again, something we've talked about here and in our state and local implementation calls about how states and localities are starting to use all of the new federal resources, including the CDBG dollars, ESG, even the disaster relief coronavirus, or the Coronavirus Relief Fund, to create new rental assistance programs. So the Urban Institute has been doing some analysis and tracking of all of these new programs that are being created. And we have Solomon Green on to talk a little bit about what they're finding and what's next. So Solomon, I'll turn it over to you.
Great, thanks, Diane. Really appreciate the opportunity to join the call today. I learn so much each week from these calls, and I know how valuable they are, and I'm really honored to be able to give a preview of some of the research that we're doing at the Urban Institute that's related to these efforts. Next slide. Oops, there we go. Great, so as part of our exploration of policies and programs to protect people from the impacts of COVID-19, we're examining how state and local governments can respond to the tremendous rental challenges presented by the pandemic. We're presenting our findings in a blog series on our Housing Matters website, and I'll provide a link at the end of the presentation. But across the series, we're using new data and evidence to look at how, across 4 topics, how federal policies can strengthen state and local infrastructure and capacity to deliver assistance to vulnerable renters, what we can learn from new state and local rental assistance programs in response to the pandemic, what we can learn from previous models of emergency rental assistance, and what legal protections need to be in place when moratoria are lifted to prevent a surge in evictions. So today I'm going to present and preview findings on that second topic, and we're going to post the research on Wednesday morning. Next slide. So we know that state and local rental assistance are popping up across the country, but we know little about these programs, including how they're structured, who they serve, and what early insights can be gleaned that might help other state and local governments set up new programs or shape future federal relief. So to help fill some of these knowledge gaps, we scoured the internet and several trackers of state and local legislation. Of course, we tapped into social media as well, and we found 41 state and local rental assistance programs that all respond to COVID-19. Some of these were new, some of them were existing programs that were repurposed for the crisis, and they are appearing in big cities and small towns across the country and in states with leadership that spans the political spectrum. We then took the programs that we found and we coded them on a range of dimensions and features, which I'll share with you on the next slide. But importantly, we also interviewed local leaders running 3 relief efforts that represent a mix of state and local, public and private programs in order to ground truth or findings and elevate some lessons in real time. Next slide. So these are just some of the broad trends that we found across programs. We looked at who administered and funded them, who they're serving, and what some of their key features and limitations are. We found that most of the programs are administered by government agencies, and they're mostly funded through state and local resources, including housing trust funds, general revenue, philanthropic dollars. Nevada, the state of Nevada is actually using $2 million from a legal settlement with Wells Fargo to fund its emergency rental assistance programs. Several of these programs plan to use funding from the CARES Act when it becomes available, but none of them that we found had already tapped into the funding. They're just building the capacity now. Most of the programs serve renters in the private market who don't qualify for other forms of assistance, but we also found some programs that serve apartment owners and landlords. And they have a real variety of eligibility requirements, but the most common we found were maximum income, a demonstrated loss of income, and residency requirements in the jurisdiction. Sometimes the loss of income has to be tied to the COVID-19 crisis. Other times it's not specified or no documentation is required. In terms of the features of these programs, not surprisingly, the most common eligible expense was rent, but we also found programs that would cover the cost of utilities and internet, legal assistance, and even in a few cases, completely flexible cash assistance. Each of the programs had some sort of limit on the maximum amount of rent or the maximum duration, but the most common limitation was until the money runs out. And for many, this has already happened, and I'll come back to this in the lessons learned. Next slide. So this is what we learned from our examination of these 41 programs and our deep dive in the 3 locations that may be useful for other state and local policymakers and could inform federal policy as well. We found the need to leverage existing programs that have adaptive capacity. Los Angeles County is a good example of this, where it's coordinating across departments to deliver its rental assistance and using 211 LA to screen eligible tenants. We consistently heard about the need to maximize flexibility, and the Florida SHIP program is a great example of this. It's a state HFA, Housing Finance Agency, that is creating dozens of waivers and amendments to get money out quickly to local grantees. We also heard the need to focus on populations with the greatest unmet need. And Atlanta Starcy is focusing on renters in the private market who live in neighborhoods with schools with high turnover. So they're an organization that's been focused on education and education equity. And so they're using this as a chance to help stabilize housing for students in high need schools. Across programs, we also found some gaps: who is either missing or excluded. And these include people who already receive housing assistance, people with no income, and undocumented immigrants. And lastly, our last takeaway, and probably the most important one for this group, is that more resources are needed. All of these programs are oversubscribed. For example, Chicago designated its fund to assist 2,000 families, but in the first 5 days attracted 83,000 applicants. Delaware was forced to halt new applications for its rental assistance program after it was just overwhelmed. So this suggests a need for significant federal investment beyond CARES to prevent widespread evictions and displacement. But there are some promising signs. The diversity of state and local governments that have cobbled together scarce resources at a time of tremendous fiscal strain and uncertainty suggests that a growing consensus exists for more federal resources. And we also see that these emerging rental assistance programs are helping build capacity to handle those resources when they become available. Next slide. So I'll put these links in the chat box as well, but I just wanted to refer you to the National Low Income Housing Coalition's resource page on state and local rental assistance programs, and we've been syncing up our list so you can find the ones we looked at on the resource page, and also the Urban Institute blog series, which appears on housingmatters.org. And in the chat, I'll give you the tiny URL, which takes you directly to the first post in the series. I encourage you to keep an eye out on Wednesday when we publish our findings on this research. Thanks so much.
That's great, Solomon. Thank you. And we do have a couple questions. If you have a moment, I wanted to also just maybe underscore the lessons learned that you shared there around leveraging existing programs, maximizing flexibility, focus on the greatest need, and that the new $100 billion rental assistance program that we are advocating for in Congress takes those lessons and applies each of them, because that program would do all of those three, and also obviously provide significant additional resources. And I think the work that you're doing is really important to find what's working well now, so that, as you say, if we're successful and when we're successful in getting that $100 billion, there are going to be communities that are already ready to put those dollars to action, and the communities that aren't yet ready can learn from the ones who are. So I think it's really good, important work that you're doing. There's a question for you on whether you're tracking how programs are determining who gets the money out of those who are eligible. So for example, who's doing first come, first served, who's doing lottery systems, are there prioritizing criteria? What are you learning related to that?
We have been tracking that, and the most common is a first come, first serve or lottery system within the eligibility criterias. Some of the that for applicants who meet the criteria, some of the programs have a special consideration clause, and some of them are trying to meet, actually affirmatively fill those gaps that I mentioned in the presentation about who's missing or excluded. So we actually see two types of programs. Some programs are going out of their way to exclude, for example, undocumented immigrants. Others are saying undocumented immigrants or people with no documented income actually will receive special consideration. But for the most part, because all of these programs are, as I mentioned, overextended, it ends up being first come, first serve, because the money is running out very quickly.
Yeah. Also, what are you seeing related to programs giving funds to tenants versus giving them to landlords or property owners?
Yeah, so most of these funds are for tenants. We found a few interesting examples of funds that are being managed through landlords. Two examples, the Atlanta Starseed program I mentioned, which is one that we dove a little bit deeper into. Works with building owners, and they've actually found this to be a more effective way to scale up very quickly, because they rely on the property owners to pre-screen the tenants. They also recognize that the property owners are in the best position to halt an eviction. So it's also for them a way of recruiting more property owners into a program they were already running before the crisis aimed at stabilizing housing. New York is proposing, and I don't think they've adopted yet, I looked this morning, a relief program for small landlords that we include in our inventory as a pending program. There are a couple programs that also have flexibility to do both, like the Florida SHIP program, but I would say the majority are aimed at direct assistance to tenants.
Great. And is there research, or what are you doing to analyze how unemployment assistance and rental assistance are interacting? So in other words, how sufficient is unemployment assistance? How do we know where it's not and more rental assistance is needed? What are you learning related to that?
Yeah, that's a great question. So we haven't been working on that through this particular research project, but others at the Urban Institute have been, and I'll post a couple more links if I can, you'll indulge me in the chat to share some of those findings. We also have a tool which folks on the call may be interested in, which based on unemployment filings, shows which census tracts across the country are most at risk of job loss. So giving the spatial dimension to the crisis. So I will post that as well. But we do know, as everyone on the call I'm sure is aware, that there have been a lot of filed claims that haven't made it into the hands of renters. The funding hasn't made it into the hands of renters, and there are also a lot of gaps in who qualifies for unemployment insurance.
Right. Okay, and the last, I'm going to make it more of a suggestion than a question to you, and that is that there are, of course, a lot of people on this call and around the country who are working in their communities to create rental assistance programs. They have lots of questions. They would love to be able to be in touch with other communities that are doing it well. And so the question or the recommendation is for you and the Urban Institute to share contact information from the programs that you're learning from.
Oh, interesting. So we thought, glad to try my best to connect people. And we only affirmatively reached out to 3 of the organizations. So why don't we share with the National Low Income Housing Coalition any contact information that we're aware of that's public. It'd be great if you could add it to the rental assistance page that you're managing. I don't mean to push that suggestion back onto you. I just want to make sure the information gets out there as seamlessly as possible.
Yeah, that sounds perfect, Solomon. I was thinking something similar. So do that, and we'll see who else we can add on for suggested contacts, and we'll just continue to evolve that list for people. So thanks again. Really appreciate your work here and appreciate you getting on the call to share it. Thank you, Solomon.
Thank you.
Okay, so we are expecting sometime soon for Congressman David Price to join. I don't believe he is on just yet. So I do want to move to our field updates, which is a really important part of our call to hear about what's happening in communities around the country related to housing and homelessness and coronavirus, what challenges people are facing, what additional federal needs they have. So I'm going to start with Ariadna from Ayuda Legal in Puerto Rico and ask Ariadna, please go ahead.
Hello, everyone. Grateful to be here. So the first thing that I wanted to mention is the thing about mortgages. We have a local legislation in place that mandates a 90-day forbearance in mortgage payments effective till June. Homeowners requested and can prove financial hardship, COVID. This forbearance is applicable to every financial institution authorized to make business in Puerto Rico, excluding, of course, federally backed mortgages. It is important to note that this law doesn't forbid or suspend judicial proceedings related to evictions or to foreclosures. And there has been some movements, some advocacy movements to have this law extended till August. Like 5 minutes ago, we got a court notice saying that the local court is finally suspending court procedures that are related to evictions or to foreclosures. These court procedures to be suspended are those that would happen during the lockdown. Puerto Rico is in a mandatory lockdown till May 25th. And the courts are working in a very limited way. And we just, after a lot of advocacy, we just got the notice out stating that no foreclosures or evictions are going to be carried out during this period. We're making also a call for rental assistance in Puerto Rico. The issues that have to do with tenants' rights outside of public housing are not a big thing. So trying to make pushes for rental assistance or to call for the rights of tenants that are renting private properties, like it's a project here in Puerto Rico. We're trying to advocate, as many of you were mentioning, about using the funds authorized through the CARES Act for low-income renters and homeless populations in Puerto Rico. In our case, we're talking about nearly $52 million that could be used in the shape of CDBG or ESG funds. We have been able to make a lot of noise in the media. We got an answer, a positive answer from the Secretary of Housing, who said that this request was, but he basically said everyone that it was municipalities and mayors who had to make the choice about CDBG. We're still asking like the local government to make a push regarding public policy. Tomorrow is May 5th, so it's a day where a lot of landlords are going to be collecting the rents, and we need now a coherent expression about moratorium for eviction and for foreclosures till the end of the summer. We're also asking for some other things that I'm gonna mention in a second, but just to give you some context, in the last few weeks, more than 200,000 unemployment insurance applications have been received. The nutritional assistance program has not been working properly, so applications have not been going by because of technical issues with all of the systems that manage public assistance. The majority of the people in Puerto Rico has been unable to receive the $1,200 since the Treasury Department has just signed the agreement with the local government. I think it was done late on Friday. We are having in the streets protests and mobilizations to demand actual food, like the opening of school cafeterias and people like trying to to amplify the need, like how hunger is shaping a lot of communities right now in Puerto Rico. Just to give you a context, Puerto Rico has been enduring 3 years of disasters. We had another seismic event on Saturday, a 5.5 earthquake, once again in the south, once again structures being damaged. And as you all know, we haven't had the chance to repair houses or to provide actual roofs to more than 30,000 houses in Puerto Rico after Hurricane Irma and Maria. So we are like a month before a hurricane season that it's going to be more active according to everyone. And in this same context, while we're asking for moratoriums in evictions, in foreclosures, and for rental assistance, we're also calling people to comment on the fourth substantial amendment to the CDBG-DR action plan for Hurricane Irma and Maria. As you all remember, we're talking about nearly $10 billion that could serve to finally provide a safe shelter to thousands and thousands of families in Puerto Rico that are still awaiting proper housing. We sent a toolkit for participation to endorse the comments that are going to be presented by Ayuda Legal by everybody. They were translated into English. And the most important thing is that we're still calling people to help us amplify the advocacy claim that has to do with the fact that this substantial amendment still includes a prohibition to provide assistance for reconstruction or for substantial repairs to more than 300,000 houses that are in flood risk or landslide risk zones. So this action plan, as it is, it's gonna exclude, once again, the poor of the poor. We can make a racial analysis of how this money is being distributed and what does it mean for people, once again, or undergoing 3 years of nonstop disasters. So I think that could be in a nutshell what's going on.
Ariadna, thank you so much for sharing that report and for your really good and important work. And just to let everybody know that an additional working group call that we have is on Thursday afternoons on issues in Puerto Rico, and it's led by people who are living and working in Puerto Rico like Ariadna, and others who are working either in Puerto Rico or on behalf of people in Puerto Rico are welcome to join that call as well. You certainly do have some significant and unique challenges. So thank you for joining, Ariadna. So I'm delighted now to introduce and to welcome Representative David Price to our call. So Congressman Price is from North Carolina. He is the chairman of the House Transportation, Housing and Urban Development, or THUD Appropriations Committee. He's a longtime champion and leader on all issues related to affordable housing and ending homelessness. And we're so glad to have you on the call today, Representative Price. Please go ahead.
Thank you. Good afternoon, everyone. I'm glad to join this national stakeholder call and to offer a brief update of where we are with respect to our various appropriations bills and to take note of your priorities. You've been very generous, of course, all along in making sure that I and the staff were aware of those. We appreciate your advocacy and your support, and we want to work you through going forward in these unusual times. To people listening in on this call, thanks to you too, all the organizations out across the country for the work you're doing on the front lines of one of the greatest economic and public health crises we will ever face, and something that we didn't anticipate and have to deal with in a cooperative and collaborative way. We know all too well, and this has been said many times, that this crisis has shown a glaring light on many of the inequities and inequalities that have plagued our society for a long time, and that certainly applies to housing. We had a housing crisis before the COVID pandemic struck, and so this new crisis has exacerbated, laid bare the inadequacy, the inequalities associated with our current national housing policy. So what's the implication of that for our response? We of course want to give immediate relief and deal with immediate problems, some of which I'll address in a moment. But we also need to use this as a foundation to build more strongly and more equitably in the future. More resources for housing and homelessness programs. The federal government needs to do much more to be an active partner in this effort. And so it's perhaps appropriate that at one and the same time, we're working on the next emergency response bill, but we're also working right along on the fiscal 2021 THUD bill, which is going to be influenced, of course, in what we do by this ongoing housing crisis, but also will be interactive with the emergency legislation. I won't go into great detail about the CARES Act. That would be bill number 3 in this recovery sequence. It was a large bill, best known, I guess, for the direct payments and the unemployment compensation and the Paycheck Protection Program. But it also had a significant THUD section that we worked on very hard. I'll concentrate here on the HUD part. We had $5 billion for CDBG, very, very flexible funding. $4 billion for emergency solutions grants oriented toward homelessness. Nearly $2 billion for various accounts to assist public housing authorities and their residents, plus other sponsors of housing for special vulnerable populations. It's vitally important for all of you to, of course, know that this money is coming, and HUD did turn it around pretty quickly. Know that it's coming, engage with the local and state officials about how best to deploy these emergency resources. Especially CDBG has a lot of flexibility in it. So there needs to be a collaborative effort to decide how to best utilize these funds. Prioritize housing and prioritize low-income individuals who need assistance the most. HUD does need to do this urgently. I give them credit for turning around the initial steps in the process pretty quickly, but they still some bureaucratic hurdles to clear. I recently conducted an oversight call with HUD officials and other appropriations members about the execution of the CARES Act. There's a balance to be struck here to provide flexibility to local grantees, but also ensuring that the resources are deployed responsibly and in accordance with the statutory requirements. As always, it's a bit of a balancing act, but we don't want it to tilt too far toward the bureaucratic requirements. We really want to get this money into the communities very quickly. So here, you too, you can be our eyes and ears on the ground. We don't want to claim too much for this $12 billion. It's a down payment more than anything else. It's clear that the outstanding need far outstrips the funding available, and that our states and local communities are already struggling to maintain basic public services as their revenues plummet. The need for more general aid to states and local governments of all sizes, that is a rallying cry as we go into this next bill. And these HUD accounts has helped some. I hope it has. I believe it has helped some with some quite specific needs. But but going forward, we need to have more general purpose assistance and to combine it with categorical assistance of the sort that I'm describing. And that's and then how that works out on the ground is the responsibility of the local governments and the advocacy groups like yours to make sure that goes the right way. The next CARE bill, CARES 2, I guess you'd call it, 2.0, will represent an aggressive response, I hope, to the crisis. I don't know if it'll be as bipartisan as the earlier bills. The earlier bills had some pretty tough fights before we got them finalized. That probably will get more challenging, but we got to have that local and state aid, and we've got to have additional funding for what we got in CARES 1, namely the ESG grants, the support for public housing authorities, the programs serving vulnerable populations, including the elderly, the disabled, Indian country programs, and people with HIV/AIDS. I want to make new investments in fair housing initiatives and housing counseling. Housing counseling, I really want to stress, because there just needs to be a lot of that kind of help available as people go through this emergency. I think it's going to be critical as more and more people struggle to find housing, struggle to pay rent, and so on. I'd like to push for funding for at least an incremental allotment of new emergency vouchers. We can target the vouchers to those who are homeless, who are at risk of becoming homeless, or other needs-based criteria. Now, you know very well that new vouchers are going to be a major political lift, but I'm committed to try to get this done. The crisis demands that we make serious investments to get people stably housed, and vouchers should be at least part of a broader response. Outside of funding for existing programs and for federally connected housing, you're well aware, I'm sure, that Chairwoman Walters of the Authorizing Committee is pushing for a new $100 billion rental essential fund. It's a big proposal. It needs to be big. Existing programs that can be used for rental assistance, including ESG and CDBG, usually don't have the ability to reach everybody that needs to be reached in terms of the median income. A robust rental assistance fund will be critical if we want to avoid the pitfalls from the 2008 recession and make sure people remain stably housed after the pandemic recedes and the stay-at-home orders are lifted. We also need a much better policy on eviction moratoriums. The current patchwork has caused a lot of confusion, and that certainly includes North Carolina. I support a blanket eviction moratorium for vulnerable and low-income people who can't pay rent due to COVID. We should couple that, I believe, with assistance to landlords who are still on the hook for payments to the bank. This needs to be a priority in the next package to make this range of assistance and requirements more equitable. The House Cares Point 2 package we hopefully unveiled within the next 2.0 package, unveiled within the next few weeks, is designed to jumpstart negotiations with the Senate and the White House, and those may well be difficult negotiations. I do have great relationships with what we call the four corners of THUD. That would be the Republican and House leadership in both chambers. Mario Diaz-Balart of Florida, the former chairman, now ranking member on the House side, Susan Collins of Maine, the chairman in the Senate, and Jack Reed, the ranking member. Jack comes from Rhode Island. I'm confident we can come to bipartisan, bicameral agreement on housing investments. But the key is going to be how much running room do we have? How big is the legislative package? How much do we have to invest? This will determine how ambitious we can be when it comes to housing. And you know, there are many other priorities for this bill. I've stressed the state and local support, which of course directly interacts with what we need to do in housing. There's also the need to overcome President Trump's resistance and save the post office. That is absolutely a priority. So is more help for our health providers. So is attention to voting and to the protection of our democracy. There's a lot that's got to be dealt with in this next bill, and I'm determined to put housing and community development on that list of priorities. So we have more questions than answers, perhaps, about exactly what this package is going to look like. But we know what our ambitions are. We're getting a sense of what the needs are, and we of course need your input as to what should be included. So thank you for your advocacy. This is about public health, but it's also about our long-term commitment to a just and equitable society, a moral imperative, and you all articulate that every day, and I'm very grateful to you. Thank you. I'll be happy to answer any questions you have.
Well, thank you so much, Representative Price. We couldn't agree more and are so grateful for your leadership, both in securing the original $12 billion in the CARES Act, which is being put to good use today in communities across the country, your leadership in keeping a close eye on HUD to make sure that those funds get out quickly and efficiently, and in your leadership in acquiring all the additional resources that we know are needed, including some of our top priorities like a national eviction moratorium, $100 billion in rental assistance, new Section 8 vouchers, and more. So we're really grateful to you for your leadership and for being on the call today. Thank you so much.
Thank you.
Take care.
All right. We'll be in touch. Hope in
Okay.
person before too long.
We will. Thank you.
Thank you.
All right, so glad to have Congressman Price on to share those updates and the work that he's doing to secure all of these needed resources in Congress. And I want to turn back now to field updates and turn next to Joan Service, who leads the Arizona Housing Coalition in Arizona. So Joan, please go ahead.
Hi, can you all hear me okay?
Yes, just fine, thanks.
Thanks again to the National Low Income Housing Coalition for having me. Like many other states, the Arizona Housing Coalition and our members are working quickly to assess what federal, state, and local resources are available to address housing instability exacerbated by this pandemic. We're working with local leaders to quickly bolster existing rental assistance and eviction prevention programming, supported by the combination of federal and local funds and the state's $50 million allocation to a crisis fund addressing eviction prevention and homeless assistance passed right before the state legislature recessed. We're awaiting word on whether our state lawmakers are going to return to the state capitol to just adjourn sine die or finish the remaining work on bills, which includes the creation of a state low-income housing tax credit, something that the Arizona Housing Coalition and our members have invested a lot of time and energy into ensuring its passage. As NLIHC can attest, Arizona is the third worst in the nation for affordable housing. And while we need to have rental assistance to help eligible renters afford housing in the private market, we also need more housing units built. And this bill's passage, along with the passage of Senator Cantwell's Federal Affordable Housing Credit Improvement Act, would be a positive step in that direction. We're also advocating when they return that our state lawmakers restore our state housing trust fund back to its pre-recession funding levels, which would have been mighty handy in helping our statewide shelter providers protect people experiencing homelessness from acquiring or transmitting COVID-19. Thankfully, some of our work last session enabled a $5 million allocation from that housing trust fund to a COVID-19 eviction prevention fund, but that demand is expected to drain that fund before our state eviction moratorium expires, which is yet another system that has been difficult to navigate for landlords and tenants, and an area that we at the Arizona Housing Coalition have been working with our legal services and multifamily housing advocates to strengthen through education and increased communication. Like Representative Price, we're hopeful that our housing counselor friends who were so instrumental during the last housing bust, that they're able to secure more funding in the next Federal CARES Act so that they can help households manage the tough financial decisions that lay ahead for us all. Like so many of you, we're using data to help inform decisions, but data is people's stories without the necessary empathy. And right now, just the data is telling us that the Navajo Nation has been hit especially hard. With only 175,000 Navajo citizens living in an area roughly the size of West Virginia, the nation has more than 2,200 cases of COVID-19, which parallels the number of coronavirus cases per capita growing as fast on the Navajo Nation as is seen in New York. This is due to chronic housing shortage, which has led to an estimated half of all homes housing multiple generations. Many residents don't have running water, and Native Americans have a higher rate of underlying health conditions, which exacerbates the disease. A century of neglect and underfunding of Native health systems is showing consequences. An important step towards addressing the underfunding is the federal government's distribution of almost $10 billion in COVID-related funding to tribal governments over the past few rounds of federal aid, and HUD allocated $200 million in Indian housing block grants to tribally designated housing entities, which are critical in helping tribes protect the health and safety of their citizens during the pandemic. Ultimately, data doesn't tell the complete story. We must couple it with the lived experience voice, so that'll be our focus as we move forward. That's my update from the Grand Canyon State, and thanks again for having me.
Joan, thank you. It was an excellent report. Really appreciate you taking the time and I appreciate your good work. Thank you. And I'll turn now to Pinky Clifford with the Oglala Sioux Tribe Partnership for Housing in South Dakota. And I'll mention that Pinky is also a member of the Board of Directors of the National Low Income Housing Coalition. So Pinky, please go ahead.
Good afternoon, and thank you for allowing me to be in on this call. It's been very, very interesting. But as you know, the Pine Ridge Reservation is located in the southwest corner of South Dakota, and we're very close to the Nebraska border. And those border towns are really our service areas where we go for food and some essential supplies. The biggest town is Rapid City, and we're going into our second lockdown, which means that the tribe has indicated that we are to remain sheltered in place, to not leave the reservation unless it's a medical or you're essential. Many tribal employees are at home. Many Bureau of Indian Affairs employees are working from home. And the tribe designates the essentials. And because we work in housing and our big housing authority, we're able to come to work and receive the passes if we have to leave the reservation. But they have checkpoints, they're monitoring, they monitor 24/7. We have to be in by 9 o'clock at night. Police enforce that. The new rule, I think today I was told that if people are outside, they're wanting people to wear masks. We have one confirmed case on our reservation. There have been no new cases. So people are taking this very seriously. Every morning, the Housing Authority has a Lakota speaker present to all of us what is going on, and really in a way explain how serious this is, how serious we have to take it. What makes it difficult when you close the borders is that with Mother's Day coming and the SNAP program, people run out of food before then. And so it's my understanding that they won't open up for the 10th, that this will stay in place until the 16th of May, 6 a.m. So what it does with our reservation businesses, small ones, and we have one large one, it puts a lot of pressure on them to try and get product. And product only comes a certain time of the week, 2 times, maybe 3. And so you have to double up. Then it puts pressure, just saying, where are we going to put it? What are we going to do with it? How long will it keep? Because once they order, they never know what's going to come in. We had a huge shortage of toilet paper for a while, bleach. And so those that are rural have difficulty if they don't have a car. We try to figure out ways to get supplies, and people have been stepping up. It's amazing. The Lakota people are known for their beautiful star quilts, and a lot of the seamstresses now are making masks, giving them away. Friends and partners of my organization have been sending us things like gloves that we have a hard time accessing, masks, and keep calling us to say, is there anything else that we can do? Is there anything else that we can do? And of course, we just tell everybody in these times of uncertainty that we really have to look out for each other and to practice being generous, but cautious. Be cautious all the time. And we know what our relatives in Arizona are going through. It's tragic. With our overcrowding, boarded up units, the Housing Authority is scrambling to try and get some type of shelter up. We have one existing shelter right now, and that needs some help. We have one organization here that is going to start processing buffalo, because if this meat shortage continues, then we are going to have to be able to supply meat to the members of the tribe. There are a lot of amazing things happening right now, but in this, while we're under this quarantine, it makes it difficult. And but to know that there are people out there who are all in a position that can sometimes, it's a humbling time for everybody we know that we're going to move forward with a different plan. Our service that we had in the past is not going to be the same again. We're going to have to figure out ways using technology to reach out to the people, to do housing counseling, to repair homes, and to build homes. Thank you.
Thank you, Pinky. You're doing such good, important work, and I really appreciate you taking the time to share it on today's call. So thank you, Pinky. So I'll turn now to Sarah Sadian from the National Low Income Housing Coalition to say a little bit more about the new bills that are being introduced this week on rental assistance and next steps. So Sarah, go ahead.
Great, thank you so much. We are so excited. I know that Diane mentioned this at the top of the call, but we're really excited to see this bill introduced this week. I just heard back from the staffers, and we have 92 co-sponsors in the House so far, and we really appreciate your efforts to contact them today and tomorrow to ask them to sign on. It's incredibly important that we have as much support as possible going into negotiations over the next coronavirus package. We know that it's going to be a very difficult package to negotiate. The Democrats and Republicans are very far apart on where they want to be on this bill. And while we're pretty sure that Democrats will include housing in their broad list of priorities later this week, it's really unclear about just how high up the list of priorities housing and homelessness resources fall, and whether this will be something that they are really putting significant efforts behind in negotiations. And so it's on us to put pressure on both Democrats and Republicans to make sure that any package includes really critical resources to prevent and respond to outbreaks among people experiencing homelessness, as well as emergency rental assistance. For example, this bill that's going to be introduced later this week. I want to give you a little sense of what the bill will do, because you'll see just how critical this can be in your communities. So the bill provides overall $100 billion that can be provided to households to help keep them stably housed. 40% of the dollars are targeted to people with the very lowest incomes, so extremely low-income households, and overall 70% of the dollars have to serve people who are very low income. So there's very deep income targeting in this bill that we really appreciate was an important feature from Senator Brown, Waters, and Heck, Representative Waters and Heck. The assistance can be used to provide short-term and medium-term rental assistance for up to 24 months. So it's a pretty significant time period that you could get assistance for it under this bill. You can also get about 6 months of back rent and late fees. This is really critical because it means that those households that may be behind on their rent but are currently protected in their homes because of eviction moratoriums, it makes sure that those folks don't eventually just get fall off a fiscal cliff once those moratoriums are lifted. Funds can also be used for stabilization activities, meaning helping to pay for application fees, security deposits, utility payments, last month's rent, moving costs, and other resources that might be helpful to move people into housing that's maybe more affordable to them in the long run. The dollars are meant to get out to communities as quickly as possible. I'll say that the first 2% of funds are allocated to Native American tribes and Native Hawaiians. The rest of the funds are distributed to state, local, and territorial governments. The first 50% of funds have to be allocated within 7 days of enactment, so it's a really short time period, with the remaining funds getting out to areas with the greatest needs after 45 days. We expect all of the funds to be spent, considering just how great the needs are in our communities right now, but any funds that happen to be unspent will be redirected, 65% of that to the Housing Trust Fund, 35% to the Capital Magnet Fund. So if there are leftover resources, we know that they'll still be invested into affordable housing for people with the lowest incomes through the Housing Trust Fund. Right now, we are working to get as much support as possible, like I said, so I encourage you to reach out to your members of Congress and not only ask them to co-sponsor this bill, but to call and weigh in with their leadership for when they're negotiating the next package. The next week or so, maybe 2 weeks, are going to be incredibly important. If you've been waiting on the sidelines, waiting for an opportunity to participate, this is really the time for you to do that. If you've already been engaging with your members of Congress, please follow up with them. Make sure that we're continuing to let them know about what the needs are in your communities and how these solutions will be effective there too. So I'll turn it over to Diane now in case she has anything else to add.
I don't. I think that was a great overview. And just to underscore again, just since this morning, we got another 22 members of Congress to co-sponsor the bill for a total of 92. So incredible work. Thank you all for everything you're doing to call your members and urge them to join. We also have 3 new senators who are co-sponsoring the Senate companion bill. So please keep it up. The more co-sponsors we have, the more this rises to the top of the priority list in the negotiations. And as Sarah said very well, we have our work cut out for us there. So thank you all for your great work. Also, I mentioned at the top of the call, all of the coming working group calls in the next couple of days. I won't go through all of them again, except to say you can find the link in the Q&A in the chat box. We'll follow up with the links to register for those calls in the follow-up email. And just to say tomorrow's calls, there are 2 calls tomorrow. One is the legislative working group that meets at 12:30 to talk in more detail about gaining new co-sponsors and making sure that House and Senate leadership prioritize this bill in the next negotiations. And tomorrow afternoon at 3 o'clock, we have our Working with FEMA call, where we'll go into more detail on what states are doing, how it's working, and how we can get states to do more and FEMA to do more to pay for non-congregate shelter. So thank you all again for joining. Thanks for all your great work, and we'll talk to you again soon. Take care. Bye-bye.